she can move better. Then of course right here on the pectoral region, I would do that longer of course. Here on the pectoral region, just come in, press down, and I'm gonna come in and push into or compress the top bone, the humerus, right into that socket. Good job, and that's what we want. We always want to hear deep breathing. So she's moving, so I'm moving with her. Again, you should do the skin on skin, but right now I'm just kind of doing over the clothes so that you can see what I'm doing. And I would stay here for about another 5 minutes or more, just until I feel like she's really, really softening. And this does wonders for the range of motion of the shoulder, because we want to make sure that she's moving beautifully. Okay, for time purposes, I'm not going to do the other side right now because you're just going to do the same thing. But also just remember, make sure that the fingers are nice and extended. See, this is beautiful. Her family keeps her nice and moving all the time. So if you're watching TV and you have your child in your lap, just go ahead and do that. Okay, and if they're active and they're not at this level like Willow is, you still want to do this anyway. Okay, now we're gonna roll Willow over. Sometimes I don't roll her, sometimes I just kind of ask to see what she's gonna do. So I just kind of move her and see if she'll do the rest of it on her own to activate some muscle work. So I'm just gonna see what she wants to do. And so there she is. I'm gonna wait here. You okay there? Good job. I'm gonna put something under her head just to support her head. And now we're gonna do the hips. So we're gonna do some compression here, bringing the femur into the hip socket, and then I'm gonna compress down. I'm gonna hold it here for about 5 or 10 minutes. And then after I'm done, I can move her hip a little bit better. And then here, I'm taking the tibia, there she goes. I'm taking the tibia in and pushing it into this, the bottom of the femur, right there. And then right here, I can grab her whole knee and push it right in. So it's all compression. This is to decrease the tone. You really want to go slowly because you don't want to force anything. If you hear a little bit of cracking or anything like that, just go very, very gently. We need to keep this area moving and preventing it from contracting. Now what I'm going to do is, let's pretend that I did the same thing on the other side, right? For time purposes, I do love to do compression onto the feet as well, and just holding the ankle here. So I would do this for 5 or 10 minutes, and then after I'm done, I'm just going to do a little bit of a rotation. This is excellent for circulation. We're boosting the lymphatic system as well and boosting the immune system. So circulation is sometimes difficult for the children. So you want to make sure that they are eliminating everything and able to absorb the nutrition that they are receiving. So that's another thing that I did. So when I did the belly, this is the hub of the lymphatic system, right? So if she is absorbing the food and eliminating the food, that makes her whole life easier, makes her heart and lungs work as well, okay? Now we're gonna go on to her belly. So we're gonna pretend that we did all that. Usually I spend about 45 minutes, sometimes a lot longer. So we're just gonna see what she does here. So there is some tremor. So we're just gonna wait and see what her body does. Good job. We're now asking her to hold her head up. Sometimes she does, sometimes she doesn't. And right from here, there she goes. She moved beautifully, no problem. Let's see what she does with this one. If it doesn't bend, if there's too much tone, then we're gonna compress here into the back and not force, but just ask. Ask if the leg can bend. Wow, Willow, you are holding yourself up so beautifully. Look at you, and look at the kitty cat come into play. All right, so she's kind of forcing her leg to be straight, so we're gonna let that, just honor that, but there she goes. So that's why it takes a little bit of time. You really wanna stay here and be very, very gentle and wait until she's ready. So I would stay here, of course, a lot longer, but for time purposes, good job holding that head up. Love it. Right now what I'm gonna do is I'm gonna come up here and we go into, there you go, she's initiating. So we're gonna go right into, I'm gonna try to get her to sit on her feet. So I'm checking her feet, and then really slowly, we're just gonna sit right here. So I'm gonna move my legs so you can see. She's sitting right there, toes are together. Beautiful. I'm gonna be here for a little while. She loves these positions. She's 6 years old, so we try to encourage positions that are comfortable and fun for her. We would stay here for a little while longer. Let's see if we can initiate a tall kneel. Can you do a tall kneel? Okay, not so much. Okay, and now we're gonna go into crisscross applesauce. Right over here. Oh. So she has some scoliosis, so we didn't address that, but I'll actually do it in a minute. But I'm actually pressing into her left back where it has that curvature there in the thoracic spine, and I'm going to encourage it to release by just pushing forward. And also I'm moving her in that direction onto the right side. So this is also a myofascial release position. And then I can place my other hand right in front of it. So I don't know if you can see, but that's the position here for that curvature of the spine. I'm gonna hold it here. I would stay here 5 or 10 minutes. When she was on her belly, that's when I really do her spine. So I'm gonna show you that. There you go. I'm gonna go ahead and roll onto your belly so we can show them that position, okay? Oh yes, good job. You're doing so good, Willow. I'm so proud of you. You're doing so good. Let's see. So we don't force her arm to go forward, but we just ask. All right, good job. So, you want to keep the arm down? Good job. Keep the arm down. All right. So I just wanted you to see the position that I forgot to mention. But this is a cross hand release onto that left side of the spine, and I would also do it on the right. So this is a really, really wonderful fascial release for what they call scoliosis. So we're going to keep it here again 5 to 10 minutes. You can't do a wrong position. Just gentle sustained pressure is the most important thing. Keeping that spine straight, but you can also do it in that sitting position, and then you would do this one. You can also do a release here by squeezing in, so 2 hands together, and just bringing both sides of the body coming in to center. So that's what I wanted to also show you. We have done a wonderful child's pose, and let's see if she'll do that. So we're just showing you different positions. You don't have to do all these positions, but I do want to just show them to you. I like the child's pose because it lengthens the spine. Can you put your hands up a little bit? A little bit. Oh, this is so awesome. So she's turning, so I'm going to bring her right hip down, and then I'm going to compress on that left side and compress on the right hip. And this is a beautiful position. It's lengthening the entire spine. It's also stabilizing her SI joint and her sacrum. This is just a great, great, great position. Again, don't do it if you feel like, you know, they're uncomfortable. You have to really listen to them. But these are just the positions that I'm able to do with Willow that she enjoys. You can see right there that there's a fascial restriction. You can see it. I can feel it, but sometimes of course you can see it. And that's where you want to stay for a while. And they will tell you if they're feeling uncomfortable. So, all right, now we're going to go back into, I love how you're holding your head up. I just love it. All right, let's go into crisscross applesauce. So I'm going to hold her spine up here on the left side, just squeezing in a little bit, just to compress and hold, and also doing a little release there with my leg. And then I'm going to ask if she can cross her leg over. So I'm asking her body if she can do that. Let's see. Are you okay with that? Is that crisscross applesauce? Yes. Good job. Good job. Oh, I'm so proud of you. Yeah, say hello, everybody. All right, awesome. Yay, good job. So from here, what we do is we put her braces on, we do sit to stand, and we actually do some walking. So that's really awesome. She loves that. All right, thank you everyone. So again, if you want, you can email me if you're out of the country. You can call me with any questions. We just wanted to do this because we want to encourage the parents to treat their kids, and for physical therapists, occupational therapists, and massage therapists, and even speech pathologists do this work too, and nurses. So encourage everyone to please treat these beautiful children with MSD so we can make their lives better. All right, thank you guys.